Good evening, everybody. Hope you've had a wonderful day. I have. Kind of stayed inside today. Sun was shining, was pretty. We didn't get a whole lot of rain. Nothing I've seen since this morning. But either way, I kind of stayed in today. Hadn't been just feeling my best, but feeling pretty good right about now. Um, Thank you all for tuning in to the Ladies Lounge with Wonder Low. I'm your host, Wonder Low. Tonight we have an amazing guest. She's been here before, so I will not read her biography, y'all. This lady is awesome, and I'm gonna let her explain some things to you. Whatever I bring her on, but we're gonna talk about a little bit about women's health. We're gonna talk about stroke awareness, some tips on being healthy, getting healthy, and staying healthy. A little bit of everything because, as we know, May is a lot of different awareness months. One major one is Stroke Awareness Month, of course. This past week we had Women's Health Month. Women's Health Week. I'm sorry, and then we had Mental Health Week happening. There's another one I just read today, and I think it's might be colon cancer. No, it's lung cancer, I think. So lung cancer awareness. So either way, we're going to talk about some healthy issues tonight, and talk about how we can get healthy if we're not healthy, and then some of the warning signs to stroke, because we know that stroke affects. I'll say in Arkansas, stroke is one of the leading causes of disability for people in the state of Arkansas. So we want to make sure that you can recognize those signs, and that if you need to get help or get help for somebody else, that you do understand how to do that. So let's do a little bit of housekeeping. If you have not before, or this is your first time joining me tonight, thank you so much for tuning in. I appreciate it. And thank you for everybody who tunes in every week to watch the shows, whether you watch it live when we do it or you watch the recording. I appreciate all of those that are doing so. If you have not liked our page on Facebook just yet, please go over and do that for me. And it's the Lady Sound for Wonderlow. You can also like us on Instagram, same name, and like us also or subscribe to us on YouTube, and make sure that you hit the little notification bell so that you get a notification every time there is a new video posted. Let's see. In the news today, and I told y'all I had to kind of take a break about a week or so ago from watching the news and tuning in, because so much stuff is going on and you get triggered. And I found myself getting upset and being tense. And I made a mistake one day, and I watched a lot of videos. And I'm going to tell you now, please don't do that. If you can avoid it, just avoid it. Yeah, we want to know what's going on. Yeah, we need to see what's going on. And it's a reason people are making those videos, so that we do know what's happening in the streets to us. But at the same time, I'm just telling you, do not watch more than one of those, two of those things at a time. It does mess with you. And it kind of got me in a weird mindset for a couple of days. So I kind of had to chill out on the watching the videos. But one of the biggest things, or the latest things I know that everybody's talking about, is the new mask rule. And I want you all to chime in the comments, if you would. Let me know what you think about the new CDC mask rule. It's saying that if you're fully vaccinated, you no longer have to wear your mask if you're out in a open public area, if I'm not mistaken. If you're going to be going into a doctor's office or someplace that says you still have to have a mask on, then of course you still have to wear your mask. But I want to know, do you all think it's too soon? Do you think that it's wise right now to go ahead and start taking off our masks when this is really not totally under control? Yeah, people are being vaccinated, but people are still getting sick, and we're still getting high numbers, positive test results across the country. So let me know what you think about that. Just post those in the comments. What else? I hadn't watched the news, so I can't tell y'all anything else. But I will say thank you all for tuning in and watching the May Rose Cafe live sections episodes. I'll be back on again this Thursday at 7 o'clock, and I've posted the ingredients for the smothered pork chops and mushrooms with veggies. So make sure that you go over to my page and check that list out. If you want to cook along with me, I'll be on Facebook and YouTube again. Might be doing Facebook Live rather than doing the streaming. So Facebook Live and YouTube, and that way you can cook along with me if you like, and make you a one skillet dinner that'll take you less than an hour from start to finish. So make sure you get that grocery list and go pick up those items so you're ready to rock and roll with me on Thursday. So let's see what else. That's enough. Y'all didn't come for me to tell y'all all this other stuff. Y'all came to hear a show and get some health information. So let's do that. So I like to say coming to the stage, although we are not on the stage, but we are in so many ways. I have, like I said, an awesome guest. She's been on before. This lady, man, when I say she's serious about her education, she's serious about helping people, she's serious about health, I can't express that enough. Stephanie Moss is an advanced practice registered nurse with a specialty in adult gerontological acute care. And I'm also going to let her explain because there's a whole lot more credentials she has other than that. But she has a master's of nursing science. She is actually a doctor of nursing practice candidate with Walden University right now. She's completed the Global Healthcare Leaders Program at Harvard Medical School. And she holds a master's of business administration with an emphasis in management. So I told you, she got her stuff together. But she is extremely, I'm going to say busy because busy is not just the right word. She is a servant. That's the best way to put it. She is a servant for God, and she serves the community. She volunteers in her church. She leads a health program in the church, and she's done so many different things. But I'm going to go ahead and bring her in. So, Miss Stephanie, welcome to the Ladies Lounge again. It's good to see you.
Hi, can you hear me okay?
Yes, ma'am. I can hear you just fine.
Okay. Well, good evening. Thank you for having me again.
Yeah, had to bring you back because we had a lot to talk about on health this evening. But I want you to explain to folks first all those nice little letters behind your name.
Well, you did an awesome job.
Oh, something.
Master's of Science in Nursing, MBA in Management, Advanced Practice Registered Nurse, and my specialty is Adult Gerontological Acute Care. And so that means that I take care of folks 12 and up.
Okay.
12 and up. And so my area has really been, I would say, in the last 8 months, doing a little bit of this and that, some of the COVID testing, some of the COVID education, really, and then some hospitalist role, here in the Midwest. And so that's been keeping me busy, in addition to my skill set, but also, serving in the community, being that advocate, that is a thing, speaking our voices and just really educating folks in the community on health initiatives and how we can really, really live our best lives.
Okay. So I told y'all she was busy, that she was a servant. So now, aside from saving the world, how have you been?
Well, you know what? I've had to learn to self-care. And, we say self-care all the time, right? But what does that really look like when you are the provider, when you are the caregiver? There's been some times when I would be called, oh my goodness, she's the ever ready battery. And I didn't really feel good about that because it's like a nonstop. And, you do get tired. You get physically and you get mentally drained. And so I've just had to learn a few key things that really work for me that allow me to keep going. And I really have to be cognizant about my time and about my space. You know what I mean? And when I say space, everybody and everybody's energy cannot be allowed in your space, especially at certain periods of time. And I had to learn that the hard way. But I think with the whole pandemic season, I would say it has been really an eye opener and what I call a come to Jesus. And I'm glad I'm able to go to Jesus moment to really say, yeah, this is where I am. This is what I need. And sometimes, like, I don't know what I need. But when you think about it, to be able to go on and to be able to move forward, you have to really do some self-care. You really have to do some soul searching. And I'm okay. I'm in a better space. I'm in a good place, a good headspace, and just still moving forward. So I'm well. Thank you for asking.
Yeah. Because like you said, as a caregiver, we have to be concerned about you also, because you're pouring from your cup all the time. So somebody has to pour back into your cup, and then you have to take care of you too. So I'm glad you mentioned that about self-care. I had a young lady on a couple of weeks ago, and that was the focus of that conversation. Was we talked about how we tend to burn the candles at both ends, in the middle, and around the sides, and not consider that eventually we're going to break down. We're going to burn out a candle. The
Right.
wick is going to run out. So we have to be really careful to make sure that in the midst of everything that's going on, that although we're taking care of everybody else, that we do stop and take time to take care of ourselves.
Yep.
That's the perfect segue into women's health.
Right.
So we are the caregivers, we're the doctors, the lawyers, the candlestick makers, the cobblers. We do everything. And this past week, I was on the it's National Women's Health Week website. And I try to make a post every day on one of the things it says for us to do to get our health back or to maintain our good health. And I looked at each one of those things, and really it made me think, how many of these am I doing? You know, are we taking time to just relax every once in a while? Are we exercising? Are we breathing?
Right.
Even as simple as just taking a little break. So talk a little bit about just women's health and some of the things that we can do to make sure that we get and stay healthy.
You know what? I can appreciate the fact that you went on the website, because as I was going through the list, and it is the Office of Women's Health under the Department of Health and Human Services. And I was looking at the list of things we talk about. You know, here's a laundry list of items, of recommendations, but how can we get involved and stay involved with you know, current trends and things of that nature. And so I'm glad you mentioned that, because it is at the end, how to get involved. And so I would say, and you can repeat this too, is go to that website. The Office of Minority Health has it too, but it is the National, Department of Health and Human Services Office of Women's Health. Yeah. So some of the things that I know they listed, because I was there too, and I kind of keep up as well. Of course, it was May 9th through the 15th. And so that week was really specific for awareness for women to be able to, you know, take care of themselves and really research and understand what that looks like. You know, what does that look like for me? What does that look like for me in this season? And what does that look like for me in the future? And so some of the things that I know they started off, you know, it's a physical and mental capacity of holism. You know, oftentimes there is a disconnect. Oh, this is a physical issue. Oh, this is a mental issue, but they all go together. I mean, they both go together. You really can't talk one without the other. So in this season, I know the recommendations there's several, and I'll just list a few. To continue to protect yourself from COVID-19 virus. And so wear the mask, even though, you know, I say be informed, be educated on what the numbers are, where you are in the country, as well as your own health and what you need. So be informed. So there's still hand washing. There's still, you know, covering your mouth and nose. Some of the simple things, you know, that we've learned, you know, as kids to do. And then it's to each his own. I'm not here to push the vaccine at all, but it's to each its own. Get educated, I say, and really get informed about, you know, the risk factors and the pros and the cons. And they also really recommend, you know, we're healthcare providers and professionals. You know, we're here for a reason. And I run across a lot of folks, for several reasons, where they say, you know, I don't go to the doctor. I'm not going to the doctor. You know, the last time I went to the doctor was 10, 15 years ago.
Wow.
And so there has to be some type of consultation, some type of education. And I say, talk to your doctor, nurse practitioner, providers about, you know, the health conditions that you have, how you're feeling. I mean, like I said, we're in a whole pandemic, and lives and things have been changed. And so if I don't know, if you've not been changed, I've been changed. You know, it's really something to really sit back and think about, but really to consult with the healthcare provider. You know, I'm not going to toot the horn on education and things, but it's a lot of learning going on, a lot of sacrifice to be able to know and be able to give back, in a sense, when it comes to taking care of patients or even consulting with people. And another thing that the Office of Women's Health had was watching your weight. We know that height and weight is individual, and there is no cookie cutter approach to that. So once we start watching our weight and watching our health holistically, we can prevent a lot of, major issues and chronic conditions and even some anxiety, so being in tune with what's going on with your body, staying active. That was a key piece that I was reading about, with the whole pandemic. We had to do the social isolation. And a lot of things were shut down. So, it's like, think about what you could do at home. I know I have a little space, but I kept it moving. I'm walking around in here thinking and talking, and I know the neighbors probably were like, what is her deal? But it was a way to keep moving, when I know I really didn't need to be out there. And then they also talked about taking care of the mental health, going back there. Lots of anxiety, lots of depression, social isolation. And it is nothing to be taboo about. In fact, we're in the month, May, Mental Health Month, May, stroke, May, hypertension, all those chronic conditions and things of that nature that we as women, really, really need to understand where we are and really seek professional help. Yes, I know a couple things that we didn't talk about last month that I really like to focus on.
Go ahead.
Here is the seek help if you or someone is experiencing domestic violence.
Yes.
A lot of anxiety, a lot of issues, a lot of things going on. I can't begin to name them, but seek help. And that's all I'm going to say about that. There's a 1-800 number I have to give, the National Domestic Violence Hotline. It's a 24/7 confidential service that supports victims and survivors of domestic violence. And so that hotline is a 1-800-799-7233. 1-800-799-SAFE 7223. That's what that's all about. So domestic violence, and then seeking help for that, and then also ways to manage stress, caregiver burnout, just in general. I heard you talk about some concerns and having to eliminate some of the the noise in the environment and some of the been going on in the community, but at the same time, knowing where you are and how much of that you can handle. Practicing good sleeping habits. This was a thing for me because I'm an empty nester still. I don't know why I still say that, but I am. And so it's just easy for me to flip up and 2 or 3 o'clock in the morning, I'm going somewhere, taking a flight, I'm going here and I'm going there. You really, really have to focus on getting rest. I mean, it's so important. And then as we say, that's really about women's health. It's about really knowing where you are. I talk about when I get to the hypertension piece, knowing your numbers, but really, knowing who you are and where you are, even in the moment, taking time to really self-reflect in the moment. So I know that's a lot, but those are real key, real live recommendations that we really can use to really take care of ourselves.
Yes. I'll go back and hit on the one about getting enough sleep. Most people don't know that sleep. Okay, when we sleep, our body heals itself in so many ways. And when you cheat yourself out of that good deep sleep, not the tossing and turning or the hard sleep or whatever, but when you cheat your body out of the good sound sleep, you notice that the next day you're cranky for no reason, because some folks cranky anyway, but sometimes you're a little cranky than usual. You'll notice that you'll have a lot more stomach troubles. You get headaches a little bit more. You get body aches a lot more. It's just that whole thing about getting in the bed and just getting that really good night of sleep. I listen to music before I go to sleep to kind of calm me down, to make me kind of unwind, turning off everything. So that means no Facebook, no social media in the middle of the night. Okay, I'm guilty of that. Yes, I did it. And it's only sometimes, but not all the time. But setting the stage maybe about 7 o'clock in the evening to get yourself ready to kind of calm down for the night, so that when you lay down, you go to sleep. If you got to meditate for a little while, I think one of the things on the list was to meditate or to find a quiet space. even if you're sitting in your office and you're at your desk working, and I'm one of those people that there are days where I can come and get at this desk at 8 in the morning, and I might not get up unless until like 3 or 4 in the afternoon, because when
Wow.
I start working on something, I get in it, and I just stick with it the whole time.
Right.
Knowing how to get up and take a lunch break, go outside and get you some air, walk around for a second and clear your mind. Um, get up and stretch, even if you just can do a little bit of exercise in your seat at your desk, something that takes your mind off of everything for a little while. Because the other thing that gets us outside of not getting enough sleep is we're stressed out all the time. And I think with us being in the midst of a pandemic and for all of this to have gone on now over a year,
Mm-hmm.
we've developed everything. Everybody's developed a whole new level of new stress.
Right.
Yeah. In addition to what you were already dealing with, now you're dealing with this, and so it's just so much stuff going on. And cut back on watching things that disturb you. I try to watch, and it sounds weird, but I really try never to watch anything violent or disturbing or anything else before I go to sleep. I'll watch a comedy show
Right.
so I can laugh a whole lot before I
Right.
go to sleep, because it calms me down. So
Yeah.
it's the smallest of things we've had to learn how to do since we've all been in, and then now we're not in like we were at the very beginning. Because I can remember
Mm-hmm.
those first couple of months, and it was like, oh my God, you were afraid to go outside to get the mail. You just didn't know what was going on.
Yeah.
So now at least we are getting out. I see a lot of people out walking now. True enough, people are still walking. We have our mask on, but people are getting out of the house and we're moving around.
They're
So
moving.
yeah,
Mm-hmm.
so that at least is getting us, de-stressing a little bit, kind of giving us, getting back in the public and being able to socialize just a little bit. I'm still a little bit leery about large crowds, so I try to still stay away from that. But it almost feels like we're getting to some type of normal. Now, I won't go back to normal.
Yeah.
We get into some type of new normal where we're still, cautious about being out and around folks. So, just whatever we can do to kind of alleviate that stress, whether that's eating differently, like you said, moving, just taking those mental breaks every now and again, meditating, journaling.
Oh yeah.
I noticed that, man, it's been this, I think between last year and this year, it's probably been a million new books written. Now folks got time. You got
Yeah.
time to sit inside and write. So, journaling and doing those things. But yeah, all those are really good recommendations. So
Yes.
keep going, because you have some more good ones.
Okay. Well, and we talk about women's health, and we're not neglecting to really consider men or consider our brothers. But as you mentioned, we do a lot. We're up, at the crack of dawn. We're probably thinking about the plan if we don't have the plan already together. The night before, what we're gonna do, we're ready to go because this is what we're gonna do, and we do it until we get things done.
Yeah.
And so with that, and then we build and we build, and so really taking the time to peel away the layers. And I know I was out, I was traveling probably about a couple hours before I got on here, but I just had to get in here and just sit down and just breathe. The travel in the car, it's stressful because you got to watch out for yourself and everybody else. So the stress will take you out if it's not under control or managed to a certain degree. So with that being said, another, we journeyed in April. We went a little further about the history of Minority Health Month. And, I really, really felt good about sharing that, even though, I was challenged to do so, but we really need to know where that come from. And so just to journey back a little bit, that Heckler report that talked about, the cancer mortality, and then the increased mortality, it was like excessive mortality for Blacks and minorities. And so that report came out again in 1985, and it was Margaret Heckler, who was part of the Secretary of State, who wrote that report. Hence, there was a lot of building, of course, before that report was published. So here we are, women's health, and here we are again, and I could talk about the Surgeon General in October of 2020, hypertension. Yesterday was World Hypertension Day. So, we're still struggling with that for several reasons. And then we are, and on top of it, here's a whole pandemic. But so the Heckler report talked about hypertension, it also talked about diabetes, also talked about cancer. But again, it's a call to action from the U.S. Surgeon General about hypertension because we're still in trouble with our numbers. And so nearly half of U.S. adults have hypertension or high blood pressure, and only about 1 in 4 of those individuals have their hypertension controlled.
Wow.
Imagine that. So, and then you ask, why is that? We got all these medications, we got all these super duper doctors and providers, we got all this healthy food, we got a lot of things that we really can pull for them. So what's the culprit? It could be several things. So again, our numbers are still up, and when we talk about stress can lead to a lot of things, but really raising your blood pressure and at a point where it's not controlled is a major issue. And so we look at risk factors. One of the things I learned in my journey in school was, why? This individual may have a genetic history, they say, but what else? What are the risk factors? Obesity, smoking, stress, dietary concerns. And so those are some of the things that, again, and we talk about them ad nauseum, that we really, really need to look at, and they're called lifestyle modification or lifestyle behaviors. And so the goal, from what I understand and what I've researched here from the U.S. Surgeon General, is to make hypertension control a national priority. Oh my, we have a lot of priorities, right? We got crime and violence, we've got the COVID, the pandemic. We got a lot of priorities, but this one as well is taking us out when it could be prevented. That's one of the goals. And another goal is to ensure that places where we live, learn, and work clear support into hypertension control. So do we have sidewalks where we live? Do we have bike trails? What is the environment like? Is it a chemical plant here? Do we have, healthy water, running water here? So really making sure in our cities, across the globe, that the environments that we are in, including home and work, they are supporting hypertension control measures. And then for clinicians, really optimizing patient care for hypertension. So those are 3 of the goals for, the Surgeon General's call to action. And when I think about hypertension, when it's not controlled, I may be super, super sweet. I say I'm super sweet all the time, but my blood pressure is good, and I'm grateful for that. Because for my family, we do have a history of high blood pressure. We do have a history of stroke. So, and again, stroke actually is the number 5, it's the 5th leading cause of death. And you talked about disability. Huge, very debilitating. And so when your blood pressure is not controlled, then you're high risk for stroke. So, it's like one thing after the other. And I noticed that in my studies, which, kind of had me all over the place, there are different guidelines for what a normal blood pressure is. And so I can say that in some of the studies, the 7th report of the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure, tells us that a normal blood pressure nowadays, and I'm going to date myself a little bit, nowadays is less than 120 and less than 80. So 120 is your systolic. That's your top number. The 80 is the bottom number. That's the diastolic number. So that is what we're looking at for a normal. So I go back to over 20 something years when I first started looking at blood pressures. The normal blood pressure was 140 over 90.
Wow.
Yeah, that was
hypertension.
So now that is actually 140 over 90. That's you're in stage 2. We skipped all the way to stage 1. You're in stage 2. So a lot of research, that we've advocated for, and a lot of lobbying that, funding that we advocated for. It gets us to this point, and there's still research going on. So high blood pressure, hypertension is a call to action. And I could just say from my experience, it's been a call for action for a long time. The Million Hearts Initiative, which is, part of that entity that really gives us ideas and gives us opportunities to implement, measures in the communities for folks to get well and to get their numbers down and get them under control. So when we don't have, when we have uncontrolled high blood pressure, it leads to stroke, and which leads me to my next topic. And we know that, like I said, the number 5 cause of death and debilitating, there's a lot of rehab that goes in when folks have stroke. So it is not just, and I've heard this, a condition that for older folks,
No.
I think that's been a myth. Yeah, that strokes, that's just for older folks. But I've seen on my journey a lot of young people suffering from strokes, and not just one. And so again, it's, lifestyle modification behaviors, the smoking, excessive drinking for whatever that is for that person, obesity, and then the lifestyle. So there's a lot of preventive measures that can really reel us back in to get that blood pressure control. And that is just one of the things that in my doctoral journey that I'm working on, not really an accountability issue, but how we all can work together to make sure that we're doing the best and providing the best optimal choices for our families, our patients, our loved ones, to help them control their blood pressures. But even with stroke, I want to talk about what that looks like.
Okay.
I've seen it in the clinical setting. I've seen it in the community, and I second guessed it. But time is huge. So is really a major part. It could be a matter of life or death or debilitation for a particular person. So signs and symptoms, a sign, and we use the FAST acronym. I learned that really quick, and we use that with the American Heart Association when we're out teaching of what that looks like. So FAST is the acronym, and FAST, F, any type of facial drooping, left or right, or even both. Any type, and so we go to A, arm, any type of arm weakness, okay? And then speech, difficulty speaking, or and slurred speech might not be the thing, because slurred speech could be anything, but difficulty speaking, not able to express, and there's a term for that, not able to get those words out, and so difficulty speaking. So that's F, A. And then we talk about speech, and then time. Time is major. So once anybody sees any of those eye openers, I call any of those symptoms, that 911 call needs to be made immediately. So I don't know about you. What, have you noticed, or have you seen anybody in the community really, they've gone down or start to have some symptoms, and you thought, I don't know what that is, but here they are, actually they've had a stroke.
Yeah. I witnessed it in maybe 1 or 2 people. And the thing that I noticed first was their mouth twisting. And a lot of people, I'm going to tell you something that's so strange, because I had a young lady, and it's been some years ago, that was telling me she was in the midst of having a stroke, and somebody else had to tell her that's what was happening. And she didn't realize that the whole time she was actually still speaking. At least she was in her head, she thought she was. But her mouth had twisted, and it had started to droop on one side. And she was saying, I couldn't control my arm. And the other person, she was talking to a family member, and they were telling her, I think you're having a stroke. And she said, I was arguing back. Like, no, I'm not. I'm fine. And she said, I realized that I was speaking, but I could hear, she said she could hear a voice in her head, but she realized none of the words were actually coming out. So she couldn't speak. She just thought she could. And she couldn't control her arm. Her face had started to twist to one side, and she was just feeling really weak. So just so happened, the person did get her help. They called 911 immediately, and she got help. But if I'm not mistaken, she was 35 years old.
Yes, see?
And that was her first one. She had 4 more after that. So she kept having them. And I think before then, of course, one of those situations of having undiagnosed hypertension and thinking that you're totally fine, but walking around with blood pressure 230 over 140. And I tell people, the day that you die is the day you felt the best. You just your blood pressure was sky high. Well, I have a little bit of a headache. Well, I feel a little bit dizzy. I feel a little bit tired. Well, I'm having a little bit of trouble breathing. 9 out of 10, you're either having a heart attack or you're having a stroke. Most people don't get that.
Right.
My mama is the one, I think, that it's funny. It's laughable in so many ways, and the way it's not. My mom had a stroke, and her best friend was telling her, "You're having a stroke." She fussed at him for like an hour, and she drove herself to the emergency room.
Yeah.
She walks in the emergency room. She still does not know she's having a stroke. But she had one. And, I said, God is so good that, number one, he got her to the hospital and she was driving and she made it.
Yeah.
But she had I think the only effect that she had was she lost a little bit of feeling in her hand for a little while and one of her feet.
Okay.
Back. But then I've seen other people have major strokes and they are literally now disabled. Their speech never came back, their movement never came back, and they have to be cared for now. So when people are saying, "Oh, it just only happens to old people," that's not true.
No, it's not true.
I have kids that are in their 30s who have had strokes recently. I have people that I know that are in their 30s and 40s who have had strokes recently. So it is not an old person's disease or an old person's episode or something that happens. It can happen at any age. My husband has a little cousin that was having strokes when she was a teenager.
Wow.
And she had uncontrolled hypertension, and they could not figure out why. So as a little kid, she was having strokes. So, it doesn't have to be, you don't have to be 65 and older to have a lot of these things. These things can happen at any age. You have kids that die of heart attacks every day. You have people drop dead on the football field or on the basketball court. So, we have to get out of that mindset of thinking that these things have age ranges on them. They really don't. And I tell people a lot of times, I was 26, 27 years old and was diagnosed with congestive heart failure.
Yeah, I know. You talked about that.
Come on, how many 26-year-olds do you know have that? And I even remember saying to the doctor, but that's an old person's. Please. And he's looking at me going, well, surprise, you're not an old person. So, it can happen at any age, and we have to be really, like you said, in tune to our numbers, in tune to our family histories, and then doing the lifestyle changes.
Exactly.
And I told you I work for an organization here in Arkansas where I do a lot of tobacco cessation training for professionals around the state. And one of the biggest lifestyle changes we can make is if we smoke or use tobacco of any form of kind, we can stop. And I know people go, well, it's easy for you to say you don't smoke. Well, yeah, it is easy for me to say, but it's also a matter of your life and your death. And it's also a matter of life and death for those people that are around you. If you smoke, secondhand smoke kills just as well as firsthand smoke does.
Right.
I was listening to a lady at the event we did a couple of days ago in Conway. And I call it her testimony because she made the statement that she couldn't understand why her kids kept getting ear infections. They had allergy issues. They were having upper respiratory infections all the time. They had sinus issues. They had bronchitis. They had shortness of breath. Now, these are little kids now. These are old people. These are kids. And when she finally goes to the doctor, of course, she finds out her lungs are damaged because she's been smoking. But she also finds out that her secondhand smoke is affecting her children. And she said the day the doctor said that to her, she said, I went cold turkey. And she said she's been tobacco free now for going on 10 years.
Wow. So, kudos to her.
Exactly. So going back to what you said in the beginning about we have to be educated about different things. People think, well, I don't smoke in the same room as my kid, but you're still around them. It's still in the air. It's still in the house. If you go in one room and they're in the other, it still gets around. Those chemicals in cigarettes are still going to get to those other people's lungs. So you're affecting everybody.
Right.
One of the brochures that we pass out now is you have people that don't have kids, but they have pets. And it talks about the effects of tobacco smoke or tobacco use on even your pets. Because guess what? You're smoking a pack of cigarettes. Guess who's sitting at the foot of your bed or in your chair or beside you? Your dog. So who's also being affected by that secondhand smoke? Your pet.
The pet.
Yeah. So it's just so many different things that, if we really look at what can we change, we can
Right.
eat, we can eat better. Now I say that and I know I like to cook, but I have cut a lot of sodium and a lot of fat out of things. So we can cook better, we were talking one day about how expensive it is to eat healthier. If you grocery shop, here's what I want everybody to do. When you go to the grocery store again next time, whenever you go, I want you to look at the cost of fresh vegetables and fruit and the cost of certain meats. Now, we need to watch our red meat intake, of course. We need to watch, all of our meat intake. So if you eat meat, watch the cost of meat or the healthier cuts of meat, and then watch and see how much it costs for you to eat fresh fruits and vegetables and whole grains, as opposed to packaged food.
Yeah.
That's going to tell you a lot. So, we can say eat healthy or do whatever. And it doesn't have to be that you, totally change everything. It might be just lowering your sodium. Watching watching the amount of processed sugar that you use, processed fats, all those things contribute to these tires we carry around our waistlines, which also
muffin tops.
Exactly. It also becomes a stroke indicator.
Yes, it does.
I read the numbers the other day. Of course, I don't remember them, but it was men who had a certain waistline over a certain number, women who have a certain waistline over a certain number. You're more apt to have a stroke or develop heart disease and diabetes and all these other things, because what else causes these little tires that we carry? Stress.
Mm-hmm.
Your cortisol is out of whack. Your hormone levels are out of whack. So there's so many different things that we have to educate ourselves on so that we can get healthy and stay healthy.
Mm-hmm.
And that's a whole industry. That's a whole job in itself. Just watching what we eat and what we put in our bodies, but definitely watching those signs for stroke and then getting their help. There are a couple of hospitals in Arkansas that are stroke centers.
Mm-hmm.
And of course, I don't remember one of them. So if you're in the Little area, then get somebody to UMS or at least call. They have telemedicine. They have ways to be able to help people quickly if you do call in and you do an emergency call and you say the person's having a stroke. But that is most effective, that you do get them to the doctor as soon as possible.
Yes.
Because like I said earlier, one of the biggest debilitating diseases or occurrences in Arkansas is stroke.
Mm-hmm.
So we got a lot of work to do. And by us being in the country, and I make the joke all the time about we fry everything, including water, if we could, we have to watch what we're putting in our bodies, because between the stress and the lifestyle and the eating and all the different things we do, we're contributing to that number. So we have to watch those things. So what else do you have for us?
One of the things that I recommend, because, we talk about diet, and I'm one of the, I'm from that rural Brinkley, Arkansas, I'm telling you, and I'll never deny it. And we had some good cooking going on, and we still got some good cooking going on today. Mm-hmm. But one of the things that I'd like to share, one of my family members, so in the Kansas City area, and we're close in age. I can remember. And my uncle said, you know what? I think she's having a stroke. I said, did you get off the phone, call 911? And this is pre-nursing, call 911. And she did. She had a stroke. And so I was just kind of hanging out with her, that summer, just, trying to see how she was doing and, making sure I'm all over it, pre-nursing, making sure that, she had her medicine and things of that nature. But one thing that we talked about, she said, they're telling me that I got to cut off the sodium and I got to cut out some of the sugar and things of that nature. She said, wow, I'm going to have to learn how to cook all over again. And I looked at her and I'm thinking, well, that's kind of where I was learning how to get, do my meals. I'm going to have to learn how to do some things different too. But fast forward, so that was years ago. And just recently, a few months ago, we were out. I had gone and ran some errands with her. And so we're out at the grocery store, right? And she says, oh, I'm not getting all that stuff. She's reading labels. She's looking at the sodium content. She's looking at the sugar. It's all in her mind. She's already got her meal plan, and we're talking about some good soul food cooking people, right? This sister has changed, made a really lifestyle change in her dietary consumption. But there's other things that she says, I'll get to that when I can. So what I would say, you know, what I would say what makes it work for you, it's a large umbrella, but just take off bits and pieces of it and see and be successful that way. And then, some pillars again to prevent stroke is basically, really having that conversation, knowing your numbers, getting your labs drawn, getting that physical exam done with your provider, and then taking control of the blood pressure. I'm not going to say eating less because I don't know what people's dietary needs are, but just make sure that you are in tune to what you need as far as consumption, and then looking at those labels, looking at, how much sodium is normal and how much sodium is in this package and things of that nature. Those are some simple things. And I promise you, I would have never thought she would look at things in that manner. But guess what? If she knew better, it may have taken a while. She's starting to do better. So, it's not like we're in the woods. We ain't gonna stay in the woods forever. We're gonna have people with uncontrolled high blood pressure. But I'm just convinced that we're gonna do better. We're gonna do better. And then the smoking cessation, thank God for you and your team. Yeah, because that's huge. We say it's easy, stop smoking. It's easy for us to say, but I think when people have tools and resources, they can be successful. And then again, you know what? I didn't talk about this, and I'll put this out there. Control the diabetes. You can't talk high blood pressure, stroke without talking diabetes. Your diabetes is out of whack, your sugar's out of control, you're at high risk again for stroke and then uncontrolled high blood pressure. So just really take off, hey, I'm going to look at the sodium and I'm going to look at the sugar. I'm going to move a little bit more and I'm going to learn how to manage my stress. I'm cutting everything down. Those things don't cost you anything.
That's true.
So, these are lifestyle behavior changes that prevent some of those major, costly, debilitating conditions. And so with that being said, we got a lot of work to do, but I think I'm grateful, of course, for this platform and for many others that I'm able to really just share and continue to educate the community on and keep them updated about some of the new advances and some of the new research that's going on. Because like I said, we moved from 140 over 90. Now we're less than 120 and less than 80. So a lot in between of the research, a lot of, advocacy going on to make sure that we're really, really trying to stay healthy.
Exactly. Well, that is good information because the other part, like you said, I'm glad you brought up the watching the sugar too, is the other part of it is, one of the things I used to teach, I did financial education classes. And I know that people thought that this is a weird thing to mention, but I also taught the cost of being ill, the cost of being sick. And you look at what it actually costs a person as far as if you're diagnosed with cancer or if you're diagnosed with diabetes or if you're diagnosed with hypertension or if you've had a stroke. How does that affect you in all aspects of your life? A debilitating disease or injury or anything can mean the difference between you living a good life and being financially sound or you living, a life you're in bankruptcy because it can actually literally bankrupt you. And that was just for one stroke happening, one loss of income or, all those things that it can actually affect. So when we look at being healthy versus being sick and having all these things, we have to also look at how does that affect us financially? How does that affect our entire household?
Absolutely.
You have now a spouse that has to move from being I hate the word normal for some reason, I don't like regular or normal. Maybe because I'm irregular and I'm abnormal. Maybe that's it. I don't like the words because maybe it's not a good descriptor of wonder. So for everybody else, normal and or regular spouse now has to become a caregiver.
Mm-hmm.
And that's an added stress. And that's an added stress to not only that person is being taken care of, but that's an added stress to if you have small children in the home or whatever the case, or if that spouse has illnesses.
Absolutely.
You have to weigh, the whole thing. How do we look at how we stay healthy, and then how do we maintain the health of the loved ones around us?
Mm-hmm.
One of the things, and this is for whomever, because we're not going to say women anymore, because we do everything, but hey, we got men out there that handle their business too. So whoever is the grocery shopper person, the meal planning person,
Mm-hmm.
the meal preparer,
Mm-hmm.
we have to look at how do we make those small changes. My folks went a whole year and a half with no salt and didn't even know it.
See?
I didn't even buy salt. There was not even salt in my house.
Yeah.
And they never noticed it because I learned how to cook a lot of different stuff, or actually everything, without adding any extra salt to it.
Mm-hmm.
And they never missed it. And I think the only reason I got found out because I had a cousin visit. Some people salt their food before they ever taste it.
Uh-huh.
One of them.
On the prowl.
The first thing she did was, "Where's your salt shaker?" I'm like, "I don't have one."
Mm-hmm.
We don't use them. So, but learning how to cook with different herbs, learning how to cook with different other seasonings, and substituting different things to get some of that sodium out of your diet.
Mm-hmm.
That in the past years, high fructose corn syrup has been the culprit. That has been, oh my God, everybody has probably pretty much talked about how to eliminate or remove it from a lot of different foods. Finding those different natural sweeteners. Everybody pretty much. A lot of folks don't have a sweet tooth, but you got a whole lot of folks that do.
They do. Mm-hmm.
And I want to find ways that you can sweeten things, but sweeten them in a healthier way, where you're not using refined sugars all the time. You're not using high fructose sugar or syrup. You're not using blends and even the sweeteners. Different ways to prepare food that still tastes good, that's still beautiful to look at, and then wonderful to eat, but also making it to where I'm not worried about dying because I ate it.
Right.
I just want it to be a little bit healthier. And honestly, I'm the food preparer, buyer, cooker, whatever you want to call it. And over the years, I've changed even how I grocery shop.
Yeah.
I changed how I plan our meals out. I've changed how I prepare different things. I love fried chicken, but guess what? I probably have not fried chicken now in about 5 or 6 years.
Wow. Mm-hmm.
I just don't. Mm-hmm. Actually, I hadn't fried anything other than that. I'm sorry. I apologize to y'all. I had to fry my catfish.
Yeah.
I had to fry it.
I ain't there yet.
I apologize. Now, look, I'm growing, but I ain't grown.
Yeah, I ain't there yet.
I ain't there yet. God still with y'all. Look, what do you say? Y'all know my heart.
Right.
So, but I don't eat it all the time.
Right.
So it's one of those things that when I want something, I want it. When I don't, I don't. But still baking it, grilling it, you'd be amazed at how good things taste if you just prepare them a little bit differently. So, I think one of the cooking shows I'm going to probably do stuffed catfish, and yeah, it's going to be good.
I got to make sure I tune in on that one.
And it's not fried, but just changing how you cook different things, and then choosing fresher things to eat, choosing more fresher fruits, choosing fresh vegetables. We in the country, and I'm gonna tell you something that is funny to me. Well, you know what? Not funny, but ironic. That we live in a rural state, and contrary to what y'all believe, and I'm talking to Arkansas folks now. Just because you live in Little Rock don't mean you ain't country. So quit thinking that. This is a rural state. Understand me when I say that. All of us from the country. So if you go anywhere else in the world, I don't care where you're from. They don't say if you're from Arkansas, you're from the country. So get over it. That's what it is. Whatever. Anyway, you'd be amazed at how many people think that fresh fruit comes from the grocery store. Yeah. Like if I said, here's an eggplant. Number one, what is an eggplant? If I said, here's yellow crookneck squash. Well, where does that come from? Well, you understand that apples come on trees, lemons come on trees. They understand that part. But when you get into the vegetable section and you start bringing out leeks and radishes and all these other things, you'd be amazed at how many people don't know where they come from.
So it's all about education again,
Exactly.
Yeah.
And if I don't know where it comes from, then obviously I've probably never eaten it.
And
I probably don't know how to prepare it either.
Right.
And not understanding that you're missing cheap, healthy food, by eating some of those fresh vegetables or more fruit. I'm one of them folks, I started about a year ago, and I kind of forget about it sometimes, and when I remember, I'll do it now. But I said that every vegetable that is in the vegetable aisle on the fresh stand, I'm going to try one new vegetable a week.
Oh, nice.
That way I'll work my way through, and I'll look up recipes, and I'll cook them, and I'll make them. And so far, I pretty much have eaten everything I'm still working on some fruit that I don't quite recognize, and I got to figure out how to cook it or make it or do that. But just doing that, and now some of it is expensive, and some of it I'm just not paying $5 for one piece. But there are certain things that if you don't know what leeks taste like, leeks are very inexpensive. Get you one stalk and then find a recipe and cook them.
Right.
People eat cabbage, but don't eat the purple cabbage or don't eat the red cabbage. Make you the most beautiful coleslaw you ever had in life. And it's wonderful. Stir fried. It's so many different ways that we can take the simplest, cheapest pieces of vegetables and fruit and prepare and eat healthy without spending a whole lot of money. So one of my cooking show is going to be to show people how to do some of that stuff, because you'll be amazed. You passing up really good food is all I'm going to tell you.
Yeah.
Cook some good stuff. But let me got a couple of minutes. Do you have any closing remarks or anything else you want to add? Or you still working on your doctorate now, right?
Yes, ma'am. Yes, ma'am.
How far?
I'm looking to graduate 2022 of fall. So I'm stretching it out a little bit because I'm looking at some entrepreneur opportunities. And that's a soft launch in September. So again, I had to slow my roll. And I just want to share that, we have the conventional medicine. We have the conventional mindset. We have the conventional education. But I just think that at some point, people should understand and be able to have options. And so with that being said, along my journey, just because of the way, some groups of professionals are taught and what they've learned, I don't see a lot of options out there that are maybe discussed. And for several reasons, especially if you're in a clinic setting and you got the insurance gurus behind you, you got 15 minutes, you got 10 minutes to see this person. So, the blood pressure issue, yep, this is what, standards of care are. This is what I'm going to prescribe. Boom, they're gone. Well, what about the lifestyle, the weight loss? What about maybe some other natural thing? What about what they want? And so when I look at entrepreneurship, I'm looking at some integrative and functional ideas.
All right.
Be able to introduce to folks, when we meet and when we have conversation and dialogue about their health and what that looks like from a wellness perspective. So I just say to the community, don't give up. Take heed to some of this information that we're sharing. It's free.
Yep.
And really, just little chunks at a time. Never despise small beginnings. I was just so happy to see my loved ones say, hey, this has got too much sodium in it. And I'm like, whoa, I ran across the other aisle and was just doing a dance. And then I walked back over there and I said, well, I think sure I better look too, because this is huge. But just know that, your journey into wellness is not in vain. I think people will get there. People will get there on their own timing, faster, slower than others. But just take some of this information and really, really digest as much as you can to get started. Implementation and getting moving forward is everything. So I mean, really, that's all I have to share. The doctor is coming. I've had to slow my roll because of some other things that, I've got the vision going, and it's time, I have to move in seasons, and what I have in front of me may have to move along, but a little bit slower than what I got to do now. So that's where I am. I'm journaling, I'm writing, blood pressures, band-aids, and beyond. Stay
Oh,
tuned.
wow. Okay. Can't wait till you see that. All
Yeah.
right. Well, thank you so much. I so appreciate you. As always, you always give us good information, things that we can live by and be healthy by, and that we can keep moving and we can share with our families and share with our friends. So I so appreciate you coming and spending your time with me this evening.
Yes.
I'm going to put the stroke awareness signs one more time on the screen.
Okay.
So,
Wonderful.
if anybody has you accounted any of this, that way you'll know what you're looking for. Just remember: fast, face drooping, arm difficulty raising your arm, difficulty speaking. And call 911 immediately.
Immediately.
Make sure that you know those signs of stroke. So if you're out and about or if you're at home, then you can help your loved ones, you can help your friends, you can help your neighbors.
Yeah.
We will be back, or I will be back. I don't know why I always say we like as gang goes, but I'll be back home Thursday at 7:00.
This is awesome. Yeah.
And we're going to be cooking. So join me in the kitchen in Mayrose Cafe Live. I'll be making smothered pork chops with mushrooms and veggies. So you'll want to tune in. And these will be fresh veggies. So you can see how we can cook some things that taste pretty good. Low sodium, low fat, and
yes,
have a good meal in under 1 hour. So thank you again for tuning in.
You're welcome.
Yeah. We appreciate you all joining us tonight, and we will see you later. So, one last thing. If you have liked, please like, share, view, all that good stuff. Facebook, YouTube, and Instagram. Make sure you do that for me. So I will see everybody again Thursday night. Have the rest of the night. Have a good tomorrow. Get you some rest. Go to bed. Go to sleep. Get up. Do this thing all over again. So I'll see y'all Thursday. Thank you again, Stephanie. And
you're welcome. Bye-bye. Take care.
All right.